Thank you very much. And now I will ask to join the stage our Finnish colleague, Heidi Paakkari. And Heidi is a project specialist at the Wellbeing Services County of Päijät-Häme in Finland. And she presents us the journey towards the everyday adoption of technologies in home care services. So Heidi, please, the floor is yours. And like previously, you also have a chance to use Slido for asking questions to Heidi.
Thank
Please.
you.
And there's a clicker.
Should I just press the... Okay. Thank you. Good day, ladies and gentlemen. I'm very excited to be here today. I'm looking forward. This sounds like an amazing day with great workshops and some new technology to scope. I'd like to thank Kitty for inspiring conversations prior this event today, and also Emily Volberg for making me feel very secure and planning my trip excellently. Thank you. I represent the Wellbeing Services County of Päijät-Häme, where I work at the rehabilitation and services for the elderly. And during this year, 2025, I'm responsible for a project. We open a showroom for people to get information on welfare technology and physical aids. So this is the Wellbeing Services County of Päijät-Häme. There are 21 Wellbeing Services counties in Finland as of January 1st, 2023. The Wellbeing Services County of Päijät-Häme is responsible for the organization of social, healthcare and rescue services. It serves over 200,000 inhabitants and employs around 7,000 personnel. As you can see, it includes 10 municipalities, and Lahti is the biggest city in the area with some 100,000 inhabitants. Wellbeing Services County of Päijät-Häme includes city elements, rural elements. It's quite challenging geographically. It holds quite many bodies of water, and the distances are quite sparse. With this slide, I wanted to demonstrate you the difference in the responsibilities between the municipalities and the welfare service areas. The municipalities are responsible for organizing daycare or early childhood education, schooling, employment services, as well as health and well-being promotion and culture and housing. These are the different areas of responsibility that we have in Päijät-Häme. As you can see, home care falls under the responsibility of services and rehabilitation for the elderly, and home care forms its own entity. I work as a service coordinator in the service counseling, and in this, the entire services and rehabilitation for the elderly unit, we work very, very closely together. I feel like This might give you some scope regarding some of the questions that was asked just moments ago from Christine. The social welfare and healthcare reform in Finland took place in 2023, like I said, but this didn't mean such a big impact for Päijät-Häme because we had already organized many of the services in joint authority, and I just looked at our strategy on Friday, and it said there that we've been doing this for decades, and somebody said like 20, 30 years. So in some form, maybe not in this form, but in some form. So it takes a time. Kohti project was, I guess you could say, a milestone on how our current services or system is operating. The key findings from that project were that the best advantage came from the medicine dispensers or the medical robots, like Christine said, and the use of virtual reality glasses in personal orientation. Our current way of doing things follows very widely the national Kati model that we had in Finland. In Finland, home care is obligated to be provided 24/7 every day, and services to home are a priority that is written in the law. Our goal in Päijät-Häme for 2025 is that 94.5% of people over 75 are living at home. This, of course, means that the housing must be suitable and age-friendly and accessible and safe. And on the right-hand box are some of the services that we are providing to ensure that. The core components of technology supporting smart aging and care at home are, of course, the technology itself, but like Christine and Niklas said, it's the service system, it's the client and their network, and what enables this is funding, policies and training. And the overall goal is improved quality of life, enhanced safety and better health outcomes. I feel like I'm saying the same things that you are. Sorry. It's okay. This slide visualizes the tasks for the Wellbeing Services County when utilizing technology. The main thing is the coordination of tech use and also the leadership or management. It's very vital. But also very instrumental is make use of the data that is collected, data protection, the architecture of the technology, managing how to manage equipment, IT support, training, all the good stuff that Christine was mentioning. And this is the service path of a home care client. And the technology can be implemented in all of these stages. As you can see, we did some collaboration with VOPD, and we have I've implemented some of the same pictures here. But these are the technology, the current state of technology in our home care, or as to say, the elderly care and rehabilitation. We have an electronic patient record It helps us optimize workflows. For example, we have a mobile application for gathering all the data to the electronic patient record. And we are also beginning steps of electronic patient record for social care. And the combination to the electronic patient record from social welfare and healthcare is not an easy task. Our latest numbers are in, and we have 145 clients in remote care at this moment. It's a bit over 7% of our whole home care provision. We provide our own home care, but we also buy home care from private home care companies so that we are able to provide the home care for everyone. We have around 650 medical dispensers or medical robots at this moment. We also use sensor technology. Right now, it's used so that we put sensors in older people's homes, and we check what their day-to-day activities are and how active they are and what time of day they are active. It's in regards when a person is thinking about maybe to move to assisted living, and also those GPS watches and electronic locks. And also in knowledge and knowledge sharing area, we have portals for introduction and education. For professionals, we have virtual reality in the personnel orientation. We have info boards, and we are in close relations to IT partners and digital mentors. And my absolute favorite is this Gili AI. It's an artificial intelligence that gathers data from the person to this electronic patient record. And it also makes recommendations and alerts nurses if it sees something that it's concerned of. These are few pictures I found of our. These are medical robots on the top there. Your left is Axitare, which is a medical robot where you can get your medicine from the cup. And on the right-hand side, I think that is Suvanto Care device. There you have to use bagged medication. The pharmacists put the pills in the bag and then the bag in the robot, and it gives out the medicine in time. And on the last one is an ongoing a remote care visit to a person's home. Or, well, not really. This is a colleague of mine. My time is limited, but I thought that since the resident assessment instrument is such a key tool that we use, I'd give you some information on that too. And this slide demonstrates what our remote clients are like. They are mostly independent in their daily activities. Oh, sorry, this is a slide where I'm telling you where we can use it. We can profile home care clients with it, and we can use it in a basic need for service inquiry. And it's also a very good quality knowledge tool. This slide, however, shows what our remote care clients are like. Most of them are independent in their daily activities. They have need of assistance in one or two instrumental daily activities. They have no or have a mild disturbance in cognition. They are able to communicate with one or more senses. They don't have behavioral challenges or show signs of depression, or they can have pain issues, but they are able to take care of it themselves with help of verbal assistance. And they are in such good physical health that they are not in a great fall risk. I'm unable to show you the real questionnaire because Vitek Raisoft owns the license and it's there to be shown. So this is my variation of it. But as you can see, even though most of our clients don't have any behavioral challenges, you can still have some mild. So it's not like one shoe fits all. It's really also in here you can have some variety in what kind your clients are. And this is a picture of the showroom that I'm working on at this moment. It's open to public in community-based building. It's a shopping center, smaller than this, but a shopping center. We aim to spread awareness of what's out there with information how to acquire it. And like in the Kati model, we actually found out whilst collaborating with VOPD that we need to support the inhabitants and their use of technology and assistive products. And this showroom is, or the target group is people who do not have home care services. And we would love to make an impact on people so that they know what's out there and they know how to use it and are familiar with the solutions if and when they need the solutions or need of more comprehensive care. Lastly, like I said, it has taken some time to be where we are at this moment. I think one of the key elements is, like said here before, our services have been designed, yes, very cost effectively, but also very client orientated. That means that the clients and the end users, we've invited them to be a part of this program. And as a service coordinator, I find that you need maybe sometimes to sell the idea of technology to others. Maybe it's the client, maybe it's your coworker. And as a service coordinator, I use videos and pictures, and I make sure that I explain the client and their families what is expected of them when we are talking about remote care or technology use. And the pictures and the videos, they help really a lot. And also we have in home care, we have a welfare technology mechanics and also digital mentors. That the welfare technology mechanic is a person who installs the equipment, is responsible for developing the processes, but also to point out possible new clients in or recognizing them. And just like in Christine's speak, when introducing technology, I think that one must focus on training, cooperation, support, introduction follow-ups, user engagement, etc. There's a lot of things that you should like you said, it's not just a one-man show. Before I go, if you are interested in the showroom project or anything you want to talk about my work or whatever, I like my job. I like to talk about it. So please feel free to come talk to me. Thank you.
Thank you very much for such an interesting presentation. We have a lot to learn from Finland at this stage. Do you have any questions from the audience? I will give a priority to the audience questions, of course. Yeah, please. A mic, please.
Thank you. Your electronic patient record for data gathering and this assessment tool, like you had, both of them are crucial for providing a service. And my question is, if habitants move to another municipality,
In the welfare,
let's say outside of your area, to Helsinki or wherever, so you already made up a huge work searching the background and etc. How the data is shared for other municipality, considering data protection, GDPR, and other many regulations what we have?
That's an excellent question, and it's like what Niklas said. When you are working in a bigger areas, you get more silos in there, and at this moment, the data is not very well transformed to other well-being services area, but we are going there towards it. And from 2026, the Kanta system is so that we have a united pool of information where we can collect information from patient records and such from the Kanta, I mean. But when recalling your question about architecture and such, that doesn't move with the person. So it stays, and then the other one starts their own work.
Question from the audience. Thank you for interesting presentation for sure. Regarding showroom, is it open for Estonian companies as well who would like to present their solutions for Finnish audience?
We have a policy that it's open to anyone or all companies, but the solutions must be able to be bought. The Finnish consumers must be able to buy it themselves. But sure, why not?
And there is also a question from Christine. And we also have Slido questions, so who wants to ask in written format, please use this opportunity.
Yeah. Am I allowed to ask a question?
Of course.
Well, in the Swedish system, the payment to the private providers is a bit complicated because the agreement they have with the municipalities that they are paid by physical visits. But if we, for example, implement the medical dispenser, the Evondos or Avitare, it reduces the number of physical visits. So the private providers are not paid. So how is your solution regarding this?
We are, our remote care visits are, in terms of payments, are the same as a physical visit. So to the technology provider, it's the same, and for the person also, the person's fees are also the same.
Okay, you have another question?
Yeah, I'm just going to make a comment for the question about the electronic health record. Kanta is a system where you get it's a Finnish national system where all healthcare data is collected, and from 2026 it's going to be social care data as well, meaning that you as a citizen can go into Kanta and find all your data that belongs to you.
And also for me as a social welfare professional, if the person comes from another well-being services area, I can reach the Kanta record and ask for the basic or all the information that I feel I need to be making the assessment. So it helps a lot, but it's in the future regarding the social welfare records, but healthcare records are already in there.
And we have a question in Slido. It's about who pays for these services. Are these home services for elderly in Finland paid by the public sector, by municipality, or they are self-paid by the consumer?
The funding is like we have a money game in Finland called Pajatso. It's like this one. The main funding for the welfare areas come from the state, and then there are some other smaller organizations. But the welfare area gets a funding. It provides the services and pays an X amount of those services or for those services, and the client or the end user pays through a formula that is in the law. They pay what they can. It has something to do with their how much they get pension and how big their family is, but they don't pay extra for the technology devices. They pay for the service.
So then you are entitled to get all this fitting in your home. It comes without your own contribution, basically. So this technician comes, mechanic installs everything in your home.
Yeah, it's the welfare area that pays for the installation and the costs on that one. Yes.
Any other questions? Yes.
Yes, thank you for your presentation. Do you have separate patient safety program, or how is patient safety considered in your work?
We have patient and client safety. We have GDPR, and we have an own unit for those patient and client security or safety issues regarding the technology, but also regarding the service. And it's quite organized, but I'm sorry, it's not my area of expertise, so I couldn't tell you more about it. But if you'd like, I can find out who knows and ask about it or give an email or something.
Thank you. Any other questions? So it seems that it's a lot of food for thought. Thank you, Heidi, for coming here. Next time, please come with a motorcycle. She's a motorcyclist enthusiast, and there is a box of chocolate from Estonia. Thank you.
It's an old motorcycle. It's fun, but not reliable.
Yeah, the slower, the faster you go.
Yeah.
There is a kind of proverb.
Yeah, thank you.
Thank you very much.